Hello, everyone. My name is Nicole Raffogel with the Center on Budget and Policy Priorities. We will get started in a couple of minutes. Thank you. Hi, everyone. Thanks for joining. We will give folks another couple of seconds before we get started. Hi, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us today. My name is Nicole Raffogel. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplace and Medicaid. We are a nonprofit policy organization and are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and while we hope you will learn a lot, we are not able to offer continuing education credit for our webinars at this time. After this webinar, we'll circulate the slides, a video recording of this presentation, and other resources. We've also posted the slides in the chat. We will also post everything to the Beyond the Basics website after the webinar. Automated captions have been enabled for this webinar. To view them, click the More option with 3 dots at the bottom of your screen and turn on closed captioning. All participants are muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon at the bottom of your webinar screen and type your question in the box. We'll be monitoring questions and we'll save the Q&A for the end of the presentation. We'll also try to answer as many questions as we can as we go along. We have a lot of content to cover and may not be able to answer every question asked, but we will have a record of all your questions and we'll use them as a guide for future resources and presentations. You can also email your questions during and after the webinar to beyondthebasics@cbpp.org. Today's webinar will be about changes coming to ACA marketplace policies. We'll begin with an overview of new marketplace regulation and law, followed by explanations of these policy changes by effective date. Today's presenters are Jenny Sullivan, the Director of Health Coverage Access at CBPP, and Claire Heyison, Senior Policy Analyst for Health Insurance and Marketplace Policy at the Center. Jenny will be getting us started with an overview of new marketplace policies.
Great. Thank you so much, Nicole. And thank you so much to everybody who is here with us this afternoon. We're so glad and flattered to have such a large crowd. So we appreciate your patience over the last few months. You may have noticed that we paused our Beyond the Basics webinars and our regular email communications for basically the first half of this year. There was a lot changing both on the regulatory front and in Congress. And while the proposals swirled, we wanted to maintain our commitment to sharing with this audience only what is real and will be experienced by enrollees and assisters on the ground. I also want to acknowledge that it has been a tumultuous time for marketplace policy and for the marketplace outreach and enrollment community. We know that many of your organizations are facing deep funding and staffing cuts heading into this fall. Now, while we can't offer you the increased capacity you may wish that you had, we will, of course, continue to offer you webinars like today's, as well as our library of written resources, which we are working feverishly to update right now so that those are ready in time for our fall webinar series. But right now, most of it is still out of date. I will acknowledge that. I also want to acknowledge that if you've come to our webinars before, you might be expecting to see examples of how these policy changes affect people in practice. These are our infamous examples, or maybe just famous. There was simply too much content to cover for today to allow time for those kinds of in-depth examples. But we will be working those into our fall webinar series in September and October. So please join us again for those. Let's see if my slides will advance. There we go. So of course, we're hosting today's webinar because of two recent major developments that are changing significant aspects of marketplace eligibility and enrollment policy. First, in June, the administration finalized a marketplace integrity and affordability regulation. The regulation was originally proposed in March and is not part of the annual Notice of Benefit and Payment Parameters regulation that the Centers for Medicare and Medicaid Services issues every year in advance of the future plan years. Notably, the regulation makes a lot of changes that take effect as early as August 25th of this year, so less than a month away. And it also sunsets some of those changes at the end of 2026, which is somewhat unusual. Second, earlier this month, Congress enacted and the President signed PL 11921, also known as the One Big Beautiful Bill Act. This new law makes a number of additional changes to marketplace eligibility and enrollment policy, starting as early as the 2026 plan year. If you were following the bill as it made its way through Congress, you may recall that earlier versions of the bill would have written many aspects of the marketplace program integrity regulation into law. Ultimately, this was not done, although we'll note cases throughout our presentation today where provisions in the regulation intersect with provisions in the law. Also notably, the law did not extend the premium tax credit enhancements, which are still scheduled to expire at the end of 2025. So this afternoon, we're going to walk through the marketplace changes in the order that they will be implemented. Provisions taking effect August 25th, provisions taking effect for the 2026 plan year, and provisions on the horizon in 2027 and 2028. So before we begin walking through the provisions in the new regulation and law, I wanted to take just a minute to talk about the premium outlook for 2026. This is getting increased coverage in the press as states finalize their rate review processes, and you may have read headlines about rates going up by 15% or more in some states. Unfortunately, this is true, and it reflects that many issuers expect to see significant drops in enrollment next year as the premium tax credit enhancements expire and as people face other new barriers to enrollment. So let's remember that gross premiums, or sometimes called base premiums, are the amount that the issuer is getting paid for the enrollment. This is through a combination of what the enrollee pays and any premium tax credit payments coming from the federal government. Gross premiums are going up for 2026. That's what you're hearing about in the news right now. Because of the way the PTCs are calculated, people get a larger PTC when the benchmark premium increases. So in a normal year, that helps insulate enrollees from significant premium spikes. Now, net premiums, of course, are the amount that the enrollee pays after you subtract the premium tax credit from the gross premium. But premium tax credit enhancements are scheduled to expire at the end of this year, so enrollees will see their amount of financial help shrink considerably. Now, of course, other factors also affect a person's premium tax credit, including their income, their household size, their age, and their geographic location. Finally, what's available on the marketplace and what plans cover, how much they cost, change from year to year, as do some enrollees' anticipated needs. So if people are seeing a significant drop in their PTC, some people with fewer expected health needs might decide to enroll in a plan from a lower metal tier like bronze so that they can afford their monthly premiums and stay covered. Other people might know that they need coverage for a specific medication or a course of treatment, and they may make other adjustments in their budget to maintain a plan even as the premium increases significantly for 2026. Still others, and we know this last group is very large, may decide to drop marketplace coverage altogether if the cost rises too much. All of which is to say, net premiums will be increasing significantly for most people next year because the enhanced premium tax credits are expiring unless Congress acts before the end of the year. But lots of data points go into an individual's net premium. So be careful and cautious about blanket statements and encourage people to at least come back and look at their specific options before they make a decision for 2026. Okay, let's see. Oh, sorry, this is going the wrong way. Let me get my slide. There we go. Sorry about that. So as we walk through each provision, here is a quick guide to how the slides are coded. And we hope that we've put a link to the slides in the chat, and we'll put that in again for folks who have joined since the webinar started. And you'll have this deck, and it can be a resource for you after today, because I guarantee that if this is the first time you're thinking about some of these provisions, it's going to be a lot to digest. But the way the slides are coded is like this. The color of the banner at the top tells you whether the change is made from the regulation or the law. Provisions with a yellow banner were made via regulation and can be changed via future regulations. Provisions with a blue banner were enacted via statute and would require congressional action to change in the future. Next to the banner at the top, there's a blue icon that shows whether the provision sunsets at the end of 2026 or is permanent. However, keep in mind that regulation provisions that are described as permanent can still be changed through future regulations. Every provision has a light blue box describing the current policy in place right now before the change has been implemented. And then for every provision, we provide a short description, the effective date, and whether the provision affects all states or just a subset. So in this section, I'm going to go over the 6 changes that take effect in less than a month on August 25th. These provisions all come from the regulation and were set to take effect 60 days after the regulation was published, which turns out to be August 25th, which, if you are a calendar-loving person, is a Monday. I am sorry, slide changing is not easy today. There we go. Okay. So elimination of the low-income special enrollment period, or SEP. Right now, the low-income SEP allows people with income up to 150% of poverty to enroll in a marketplace plan at any time during the year and switch plans up to once per month. People aren't required to have had coverage prior to enrolling through this SEP. The regulation eliminates the ability of marketplaces to offer an income-based SEP in the future, or starting August 25th. And that means an income-based SEP at 150% of poverty or at any other income level. People have to experience a different SEP triggering event, like loss of minimum essential coverage, marriage, or birth, in order to enroll in a marketplace plan outside of open enrollment. I'll note that this change does not affect the special enrollment period for American Indians and Alaska Natives that allows these individuals to enroll in coverage year-round if their household income is between 1 and 3 times the poverty level. The last day for enrollees in healthcare.gov states to access the low-income SEP is August 24th. applications submitted on or after August 25th will no longer have access to this SEP. However, the provision sunsets at the end of 2026, after which time a marketplace could opt to offer an income-based SEP again. However, Claire will explain more about this, but a provision in the law will make it such that premium tax credits aren't available for people who enroll through an income-based SEP. So it largely closes the door for people to enroll in this way. But keep in mind that the administration could also change the regulations again, making this provision permanent so that that sunset went away. Next, DACA recipients and some changes to their eligibility. So for the first time last year, or for coverage this year, people with DACA status have been permitted to enroll in marketplace coverage and receive PTCs. This expansion of eligibility was supposed to be available in all states, but a lawsuit precluded it from being implemented in 19 states. This provision in the regulation permanently makes DACA recipients in all states ineligible for marketplace coverage and PTCs. Current enrollees will lose coverage. The effective date for this provision is August 25th, although given that coverage terminations tend to happen effective the 1st of any given month, people will likely lose their coverage effective September 1st. And we say likely because we haven't seen sample notices for this yet for most states. Households affected by this change should look for a notice from their marketplace that will give them more details. Losing marketplace coverage does count as a qualifying event to enroll in other coverage that the individual may have access to. This is probably not an option for most people, but technically it is a triggering event to enroll in other forms of coverage. So there's additional, whoops. Sorry, I'm trying to get my slides here. There we go. Additional documentation requirements. So if you've been attending our webinars in recent years, you might recall some of the changes that have been made to make it easier for people to enroll, even if federal databases have no information about them. But this regulation change, which sunsets at the end of 2026, will require people to complete the data matching issue resolution process if no tax data exists about them, or if the person attests to income over 100% of poverty, but data sources show them to have income below 100% of poverty. And this was done because there was a belief that people may be inflating their income to access premium tax credits. And so this was justified as a check on making sure that people whose income is not high enough to receive premium tax credits were not receiving them. These changes take effect for applications submitted on or after August 25th, and they apply in all states. A reminder that when people who are already enrolled in marketplace coverage fail to resolve a data matching issue, they'll lose their premium tax credit and cost sharing reductions, but they will remain enrolled in their marketplace plan unless they actively terminate it. People often assume the marketplace automatically terminates coverage when PTCs end, but that's not the case, and that can leave people responsible for large premiums that they weren't expecting. So that's just something to always keep an eye out for. Next slide. Yeah, it might be easier. Okay, thank you. So just a reminder that you can learn more about the process for how to resolve a data matching issue in our previous webinars, but signed statements are absolutely still acceptable. There's a long list of financial documents that could also be submitted to verify income, but you can just write a letter, send a signed statement to the marketplace explaining your name, your date of birth, and income for each of the people in your family, and then a short explanation of why you're projecting income to be what it is for the coming year or for the change in circumstances. And that is an acceptable form of documentation. There's a link to a healthcare.gov template on this slide that provides essentially what you're looking at here, but it walks you through the steps for providing this kind of documentation. Next slide. So right now, When a person is in the process of resolving a data matching issue, they have 90 days to submit documentation, but the marketplace has to grant a 60-day extension to this 90-day period for people who haven't yet cleared the DMI. And data from healthcare.gov suggests that it takes people 60 days on average to resolve a data matching issue, so it is not uncommon for people to need even more than those 90 days. This provision in the regulation permanently rolls back this protection in all states and only allows marketplaces to grant extensions to the 90-day period by request and on a case-by-case basis. This takes effect for applications submitted on or after August 25th. Next slide. Past due premiums. So this provision is another example where the previous administration made changes that the current administration is directly reversing. Right now, insurance companies are prohibited from requiring people to pay past due premiums as a condition for effectuating coverage in a new plan offered by that issuer. This provision of the regulation permanently reinstates this option for insurance companies in all states, allowing these companies to require people to pay up any unpaid premium debt with no limitation on the look-back period. Previously, there was a 12-month limitation. Before, the insurance company would allow them to enroll in a new plan offered by that company. People who can't repay their full premium debt can be refused coverage by that company. People can still enroll in a plan that's offered by a different company, though, if one is available. And issuers don't have to take up this option. This is merely an option for them. The provision takes effect August 25th, but because marketplace insurance plans run January 1st to December 31st, we won't start to see issuers exercising this option until people start to re-enroll in coverage for 2026 during open enrollment this fall. But if people have unpaid premium debt from 2025 or earlier, an issuer could feasibly require people to pay that back as a condition of effectuating for 2026 coverage. One more note, states can institute their own policies around whether issuers are allowed to do this, under what circumstances, how long the look-back period is, etc. So that is an option available to states. Next slide. Finally, the sixth provision, the last one here that starts next month, is a new standard to assess agent and broker compliance. As many of you are no doubt aware, there have been increases in unauthorized enrollment in recent years, originating primarily from agent, broker, and web broker activity to enroll people in plans or change their plans without their knowledge or consent. HHS has been reviewing some agent and broker behavior to identify cases of non-compliance with existing rules, and this change more clearly defines the standard in a way that makes it easier for HHS to terminate non-compliant agents, brokers, and web brokers from selling plans through healthcare.gov. So now that we've covered the changes that take effect August 25th, I'm going to turn it over to Claire to talk about the changes that take effect for the 2026 plan year. Claire?
Thanks, Jenny. In this section, I'll go over changes from the new law and regulation that will take effect for plan year 2026. For the most part, these are changes that people will encounter when they try to enroll in coverage during the fall 2025 open enrollment period. First, the expiration of the enhanced PTCs. As no doubt many of you have been tracking closely, the enhanced premium tax credits, which were enacted in 2021, are scheduled to expire at the end of 2025. As a reminder, Congress passed a law that expanded eligibility for PTCs and enhanced their generosity. And as a result of these enhancements, marketplace enrollees with incomes below 150% of the poverty line pay $0 in premiums for a benchmark plan. And people with incomes above 400% of the federal poverty line are eligible for PTC if they would pay more than 8.5% of their income for a benchmark plan. However, these enhancements are set to go away at the end of this year, causing premiums to increase significantly. And unless Congress acts soon to extend the enhanced PTCs, enrollees will start to see higher premiums in the fall when they start shopping for 2026 coverage. All states will be affected by the expiration of the enhanced PTCs, and this expiration is permanent unless Congress takes future action to extend them. Sorry about that. Again, really want to emphasize, even though the enhanced PTCs don't expire until the end of 2025, if Congress doesn't act soon, people will start to see those higher premiums when they start shopping for coverage in early fall, and once they try to enroll in coverage beginning November 1st. This slide shows the impact of the enhanced PTCs expiring. So as you can see, premiums would increase substantially for people at all income levels, and millions of people are expected to drop their coverage and become uninsured over the next 10 years, unfortunately. We expect that people with fewer health needs will be the first to drop coverage if premiums spike, leading to a sicker risk pool and more expensive base premiums. Another change that will go into effect during this year's open enrollment period is a new fee for some marketplace enrollees who do not actively re-enroll in coverage. So while we always want to encourage people to return to the marketplace, update their information, and shop around to make sure they're choosing the best plan for themselves, that advice will be especially important this year. Previously, most people who did not return to the marketplace to update their information during open enrollment were automatically re-enrolled into the same plan they had the previous year, or a similar plan if that plan was no longer available. And their premium tax credit amounts were updated using recent tax data. That will still be the case for many people, but starting this open enrollment, people whose premium tax credit covers the full cost of their premium, meaning that they would pay $0 for their coverage, and who don't actively re-enroll in coverage by December 15th will be charged $5 a month until they return to the marketplace and update their information. This change comes from the new regulation. It will be effective in states that use healthcare.gov and optional for state-based marketplaces. And it will sunset at the end of 2026 unless Congress or the administration takes action to change that. Now, it's important to keep in mind that the previous rules regarding binder payments and grace periods for automatic re-enrollment still apply. I can go over that in more detail later if folks have questions, but if you need a refresher on grace periods and automatic re-enrollment, I highly recommend our guide to the renewal process on healthcare.gov that's linked at the bottom of this slide. The next change, which comes from the new regulation, is the elimination of the bronze to silver re-enrollment crosswalk. Previously, people who were eligible for cost-sharing reductions, who were enrolled in a bronze plan and didn't actively select a new plan during open enrollment, were automatically re-enrolled in a silver plan with cost-sharing reductions if two conditions were met. So number one, the silver plan had to have the same or lower premiums than the bronze plan after accounting for APTCs. And number two, the silver plan had to have the same provider network as the bronze plan that the person was enrolled in the previous year. This is going away for plan year 2026. So people eligible for cost sharing reductions who were enrolled in a bronze plan and who don't actively select a new plan during open enrollment will be automatically re-enrolled either into the bronze plan that they had the previous year or a similar bronze plan. This will apply in all states, although state-based marketplaces can apply to HHS to request either the reinstatement of the bronze to silver crosswalk policy or a different re-enrollment hierarchy. And this policy is set to sunset at the end of 2026. This next change comes from the new law. Previously, lawfully present immigrants with income below the poverty level who were not eligible for Medicaid because of their immigration status were eligible for marketplace coverage and the premium tax credit. Typically, this would have included lawful permanent residents, also known as green card holders, as well as other lawfully present immigrants who are subject to a 5-year waiting period before they're allowed to enroll in Medicaid. But beginning with plan year 2026, people in this situation will no longer be eligible for the premium tax credit. They can still enroll in a marketplace plan without a premium tax credit, but that's often prohibitively expensive, as these are folks with income below the poverty line. This change will take effect in all states and does not have a sunset date. The next change comes from the new regulation. The first thing to understand, just taking a step back, is that the premium tax credit is calculated based on a person's projected income for the year. And that estimate often differs from someone's actual income at the end of the year. So everyone who receives an advanced premium tax credit is required to reconcile or true up the APTC they received when they file their taxes. People whose income is lower than they projected get money back, and people whose income is higher than they projected owe money. Previously, ACA marketplaces were required to find a person ineligible for the premium tax credit for the next year if the person didn't file taxes and reconcile their premium tax credit for 2 years. People who didn't file and reconcile the premium tax credit for 1 year were given a warning. But starting November 1st, for determinations of 2026 eligibility, all marketplaces must determine people ineligible for the premium tax credit if the applicable tax filer didn't reconcile their past APTC for 1 tax year. So this will affect people who failed to file and reconcile their premium tax credit in tax year 2024, and also in tax year 2023, since those folks previously only received a warning, and some may still not have filed and reconciled APTC for that year. This policy affects people in all states, and the effective dates are a little wonky because a similar provision was also included in the law. So under the regulation, the 1-year failure to reconcile policy will end at the end of 2026, and then under the law, it will start back up again in plan year 2028. Oh, I'm sorry, I'm having some trouble with the Okay, sorry about that. So these are some important things to keep in mind if you or someone you're helping receives a failure to reconcile notice. First of all, if someone fails to reconcile their APTC, they will lose eligibility for the premium tax credit for the following year, but they will not be disenrolled from coverage, so they'll still be on the hook for their full premium amount. And this is why it's important to update the person's marketplace application as soon as they filed and reconciled. We want to prevent people from losing APTC and potentially having to drop coverage before their 2026 premium payment is due. If someone does lose PTC because they failed to file and reconcile their APTC, they can decide to cancel their marketplace coverage so that they're not charged that full premium amount. But if they stay enrolled in their coverage, they can get a special enrollment period to have their APTCs restored prospectively, again, if they remain enrolled. And the keyword there is prospectively. They're not going to get any APTC payments that they missed back. It's only forward-looking. Also, people who lose APTC because of a failure to reconcile can appeal that decision to the Marketplace Appeals Center. Jenny spoke earlier about how the low-income special enrollment period will end effective August 25th. But under the new law, people who enroll in marketplace coverage through an income-based special enrollment period that is not connected to a life change, like the low-income SEP, will no longer be eligible for premium tax credits. This will go into effect in plan year 2026, so after the low-income SEP has already gone away and after open enrollment has happened. So we don't expect people to be impacted by this, at least in 2026. But if the low-income SEP were to come back, this part of the new law would make it very unappealing to use that SEP. Important to keep in mind that this ban only applies to SEPs that are based on income and that are not connected to a life change. So that means that people who enroll through the SEP for becoming newly eligible or ineligible for premium tax credit, or the SEP for a change in cost sharing reduction eligibility will not be impacted because those are connected to a life change, namely a change in income or household size. Similarly, the monthly SEP for Native Americans and American Indians will not be impacted as that is not an income-based SEP. This change will take effect in all states and does not have a sunset date. Another change from the new regulation prohibits gender-affirming care from being included in the essential health benefits. So as you may know, the ACA outlined 10 categories of essential health benefits like preventive care, prenatal care, or ambulatory care, and these have to be covered by all marketplace plans. But it's up to states to decide which particular health services fall under those essential health benefit categories. The new regulation prohibits states from classifying gender-affirming care as an essential health benefit. States can still require plans to cover gender-affirming care, but the state will be responsible for paying for that part of the premium that would be expected to go to gender-affirming care from the state budget. This change will go into effect in all states and does not have a sunset date. This slide and the next slide cover some technical changes that we don't usually get into on Beyond the Basics, but we wanted to cover them today because of their impact on people's premiums and out-of-pocket costs. The new regulation makes changes to something called the premium adjustment percentage, which is used to set the maximum out-of-pocket limit for marketplace plans and employer plans. And this premium adjustment percentage also sets the required premium contribution for marketplace plans, which in turn determines the amount of PTC that people get. The administration made a change to how the premium adjustment percentage is calculated that will increase the maximum out-of-pocket limit and decrease PTC amounts. So under this new methodology, the maximum out-of-pocket limit for 2026 plans will increase from $10,150 to $10,600, and net premiums, so premiums after APTC, will increase by 2.7%. This change is going to be effective in all states and does not have a sunset date. The regulation also changes actuarial value standards to allow for less generous plans. Actuarial value, or AV, is a way to compare the overall generosity of plans. The 4 QHP metal levels, so bronze, silver, gold, and platinum, all correspond to different AVs. So for example, silver plans have an AV of 70%, meaning that plans cover 70% of the cost of medical claims for covered services for an average population. Bronze plans have an AV of 60%, gold plans have an AV of 80%, and platinum plans have an AV of 90%. So you can kind of see, the plans get more generous as you go up the metal levels. And as you likely know, if you've worked with marketplace enrollment before, premiums also usually increase along those lines. So under the new regulation, issuers can offer plans with a lower AV for both on and off marketplace plans, meaning that enrollees will be responsible for a larger share of their medical claims on average. Allowing plans with lower AV is also likely to lead to benchmark plans with lower gross premiums, which will reduce PTC amounts. This change is effective in all states and does not have a sunset date. And if you're interested, the link at the bottom of this slide provides examples for how changes to the premium adjustment percentage, actuarial value, and the enhanced premium tax credits will stack up to make coverage more expensive for people this year. And I believe Nicole has dropped a link to that in the chat as well. This next change comes from the new law. So start with what a health savings account is. A health savings account allows people to deposit pre-tax dollars that can be used to pay for qualified medical expenses. But typically, these health savings accounts could only be paired with health insurance plans that had a deductible above a certain amount and that didn't cover any non-preventive services before hitting the deductible. So the trade-off with plans that come with a health savings account is that they typically have lower premiums than other options, and you can use pre-tax dollars on your medical expenses, but you are essentially responsible for paying for 100% of your medical expenses before you hit the deductible. Under the new law, this will still be the case for plans outside the marketplace, but for both on and off marketplace plans, all bronze and catastrophic health plans can now be paired with a health savings account, regardless of deductible level or whether they offer non-preventive services pre-deductible. This change will go into effect in all states and does not have a sunset date. Oh. Okay, sorry about that. The next change comes from the new regulation. So previously in healthcare.gov states, people were asked to upload documentation to prove that they qualified for the special enrollment period for loss of minimum essential coverage. For plan year 2026, people will be required to upload documentation within 30 days of picking a plan to prove that they're eligible for the following special enrollment periods: loss of minimum essential coverage, marriage, birth, adoption, or court order, permanent move, and a loss of Medicaid or CHIP. A person's coverage won't begin until they've completed the verification process. And note that healthcare.gov is already requiring documentation to prove loss of minimum essential coverage. This change will be effective for plan year 2026 and will sunset at the end of the year, the end of 2026, that is. It will apply in healthcare.gov states and will be optional for state-based marketplaces. And here we have a screenshot from healthcare.gov showing that additional verification is needed to access the SEP for loss of minimum essential coverage. And the website does note that coverage won't start until documentation is submitted and approved. And finally, beginning in tax year 2026, APTC repayment limits will be going away. Previously, if at the end of the year someone's actual income ended up being higher than their projected income, they had to repay any excess APTC they received on their taxes. But there were limits in place to protect people from large, unexpected repayment burdens. Under the new law, people whose actual income is higher than their projected income will owe back all of the excess APTC that they received. However, there is currently an exception for people who project income above the poverty line, but whose actual income falls either below 138% of the poverty line in Medicaid expansion states or falls below the poverty line in non-expansion states. And that exception will remain in place. So people with very low incomes will continue to be exempt from APTC repayment, and that is hugely important for people with variable income that is close to the Medicaid cutoff. This change will go into effect in tax year 2026, meaning that people will start experiencing its effects when they file their taxes in early 2027. The elimination of the APTC repayment caps means that next year it will be especially important for people to update their marketplace application if they experience a change in income mid-year, or if they experience other life changes that could impact the amount of premium tax credit they're eligible for, like a change in family size or getting a job with employer-sponsored insurance. And this change does not have a sunset date. While the APTC repayment limits are going away in tax year 2026, they will still apply in tax year 2025, which are the taxes that people will be filing early next year. So these are the tax year 2025 APTC repayment caps. And again, starting in 2026, people whose actual income is higher than their projected income will need to repay any excess premium tax credit received in full, except in cases where their income dips below the Medicaid eligibility threshold in states that have expanded Medicaid, or below the poverty line in states that haven't. All right, and now I'll pass it over to Jenny to talk through some changes coming in 2027 and 2028.
Great. Thank you, Claire. And thanks to folks for hanging in there. I know we're covering a lot of content really quickly, and you're asking excellent questions that we're doing our best to answer. We won't get to all of them, but we're going to try to answer some of the broad themes that we're hearing questions on during Q&A, and you will know how to find us after this webinar if you still have unanswered questions. And we may not know the answers yet either, but we will all learn together. So we are in the home stretch here, and the changes that we've covered to date are the ones that you need to be most aware of heading into open enrollment for 2026. But because the regulation and law make some very significant changes that are coming down the pike in 2027 and 2028, we wanted to be sure to notify folks about the things that are coming on the horizon as well. Next slide. So as you know, in recent years, healthcare.gov has held annual open enrollment between November 1st and January 15th. State-based marketplaces have been able to start they've required to start open enrollment November 1st, with one exception. In Idaho, y'all do it a little differently, but with the option to extend open enrollment beyond January 15th, which a lot of state-based marketplaces do. The regulation makes a permanent change, shortening the annual open enrollment period in all states. Starting next year in open enrollment for 2027, healthcare.gov states will hold open enrollment between November 1st and December 15th. State-based marketplaces are required to do basically the same thing, but they have a little bit of flexibility to set their own date, as long as they don't start before November 1st or end after December 31st. The open enrollment period has to be, I believe it is at least 9 weeks, and plan selections that are made during open enrollment have to allow for coverage effective January 1st. So it's some pretty strict parameters, but you could vacillate, or you could deviate from those by a day or two. Now, we've been hearing a lot of confusion about this, likely because the initial version of the regulation would have started this change right away for 2026. But small silver linings, nothing is changing about the healthcare.gov or state-based marketplaces' ability to set open enrollment dates for 2026. In healthcare.gov states, people will still have until January 15th, 2026 to enroll. Next slide. Finally, there's a lot on this slide. Each word is worth a lot here, but this shows the remaining changes, which are all from the law, and all of them are permanent. These are important things on the horizon, and although CMS has not yet issued any guidance about how these will work or what state-based marketplaces have to do to comply, you're going to want to keep an eye out for more information in the coming months and years, frankly. So in 2027, the law ends PTC eligibility for most immigrants in the country legally. People granted asylum, refugees, and people granted humanitarian parole are among the groups of people who will no longer qualify for premium tax credits. The only non-citizens who would continue to qualify for premium tax credits in 2027 and beyond are legal permanent residents, Cuban and Haitian entrants, and COFA migrants. 2027 is also the year when states that have expanded Medicaid will be required to implement a work reporting requirement on people enrolled in the Medicaid expansion. And there is some flexibility for states to implement a requirement earlier via state plan amendment or demonstration pathway, or to get some good faith extensions to that requirement. But in general, starting in 2027 and beyond, people who don't comply with the work reporting requirement in a state with Medicaid expansion will be ineligible to get premium tax credits to enroll in marketplace coverage. They will still be considered to, quote, have access to minimum essential coverage. They'll just need to square up the work reporting requirement in order to get or restore their Medicaid. In 2028, The law requires all states to implement new eligibility verification requirements for premium tax credits. This is a biggie. People will not be allowed to enroll in coverage with premium tax credits until they've verified household income and family size, immigration status, eligibility for other health coverage, their place of residence, and there's also a sort of a blanket statement that the secretary may determine other information at their discretion. And there's one exception to this requirement for people enrolling during a special enrollment period due to a change in family size, which is essentially intended to allow people when there's a birth of a newborn, for that newborn to be covered by marketplace coverage during a provisional eligibility period. Covered with marketplace coverage with PTC during a provisional eligibility period while their eligibility is being verified. The law also requires marketplaces to set up a system for people to verify their eligibility for PTCs annually, starting August 1st, prior to the start of the new plan year. So this basically prevents people with premium tax credits from being automatically re-enrolled. Everyone will be required to actively re-verify their eligibility every year before they can continue to get premium tax credits. Finally, a reminder that the law requires marketplaces to adopt one-year failure to reconcile starting with the 2028 plan year. You heard about this earlier. You're not imagining things. Claire did talk about the fact that there was a regulatory change that requires this, but there is technically a gap in 2027, and then it picks up again in 2028. And from 2028 forward, marketplaces will have to apply the one-year FTR policy. We don't think that that gap was intentional or for policy purposes, and it certainly could be changed via future regulation. But there are some intricate workings that went into some of the interactions between the regulation and the law when the law was being debated in Congress that may have created some of these interesting and non-policy oriented deadlines. Okay, next slide. Okay. If this looks like you right now, literally or metaphorically, it's okay. I want to reassure you that you're not alone. This really is a tremendous amount of change for 1 year. Please continue to reach out to us with questions and with what you're seeing and learning on the ground, because you are on the front lines and may often learn about things before we do. And I will say bonus points if you can share screenshots. We love to see what the application looks like as it's changing. Just please don't send us things with personally identifiable information in them. But know that you don't have to absorb all these details today or even maybe ever, but think about the big picture. So focus on these messages so that the people you serve can navigate some of these changes with as little friction as possible. We know people will be caught up in red tape and affordability hurdles, but you can help them by encouraging people to visit the marketplace and update their information and compare plans for 2026. We say this every year. This is not new. It's just really, really important for 2026. Pay attention to any and all notices from the marketplace and from issuers and respond to requests for verification by the deadline. Side note, CMS or the marketplace is sending out periodic data matching notices right now for people who appear to be enrolled in both a marketplace plan with PTCs and Medicaid. And there is a 30-day window in which people have to resolve that overlap before the person risks losing their premium tax credit. So that's an example of a notice you really want to pay attention to, because 30 days is a very short amount of time. You should encourage people to update their marketplace account during the year if their income changes. We want people to be getting the right amount of help so that they don't have a large repayment burden later. We want people to stay up to date with premium payments or get help if the payments become unaffordable. We don't want people accruing large premium debt that acts as a barrier from them getting coverage in the future. We want people to reconcile their APTCs during tax season next year and not miss that, because that could create a barrier to getting coverage in the future. And do remind people that if they happen to be losing eligibility, unfortunately, they still have to reconcile APTCs that they've received during a time that they were eligible. Finally, I am sad to have to say this, but be prepared to help people who don't enroll in marketplace coverage, who are no longer eligible for a form of publicly financed coverage, to connect with the community health care providers where you live, like community health centers and free clinics. You're going to want to refresh your list so that you can give people some options. With that, we have a few minutes left for questions. So I'm going to turn it over to Nicole, who has been really on top of the Q&A and keeping an eye on what some of the main topics are there.
Thank you, Jenny and Claire. We've been monitoring the questions asked in the chat, and we'll now try to run through as many as we can. As a reminder, you can always email us. I'm going to drop our email in the chat again if we aren't able to answer any of your questions. So there's been a lot of questions about the low income special enrollment period. This first question is for Claire. When do PTCs for the low income special enrollment period end? And when does the low income SEP go away altogether?
So marketplaces are not allowed to offer a low income SEP beginning August 25th of this year. This option will be restored for the 2027 plan year unless HHS changes this through future rulemaking. And remember, the low-income SEP was optional, so restoring the option does not guarantee that healthcare.gov or a state-based marketplace will actually offer it. Also keep in mind that beginning in plan year 2026, the law prohibits people who enroll via an income-based SEP that isn't connected to another life change from being eligible for premium tax credits. So that can't be changed unless Congress enacts a different law to overturn it. This means that even if marketplaces choose to offer an income-based low-income SEP in plan year 2027 or later, people enrolling through this pathway wouldn't be eligible for PTCs, which would make the coverage unaffordable for most people.
Thank you, Claire. We also had a few questions about the $5 additional premium payment and the end of automatic re-enrollment for people with PTCs. Another question for Claire. What happens if someone doesn't pay the $5 additional premium payment by January 1st? Are they eligible for a grace period?
Yes, so it depends on whether the person is automatically re-enrolled into a plan with the same issuer that they had in the last year or a different issuer than the one that they had last year. If someone who owes the additional $5 premium payment is automatically re-enrolled into a plan with the same issuer they had the previous year, and they don't update their information or pay their January premium on time, they will enter into a grace period. If they're enrolled into a plan from a different issuer, however, then they will owe what's called a binder payment. So in order for their 2026 coverage to go into effect, they'll need to pay that $5 fee by the deadline for January coverage to start, or update their information. If they don't, their coverage will not go into effect, and they will have to qualify for a special enrollment period or wait until the next open enrollment to get a marketplace plan. This is also the case for people with regular premium payments who get automatically re-enrolled. If they are enrolled in a plan with the same issuer as the previous year, and don't pay their January premium on time, they enter into a grace period. If they're enrolled into a plan from a different issuer than they had the previous year, then that first premium payment is a binder payment to effectuate coverage. But yeah, this would also apply to that $5 additional premium as well.
Thank you, Claire. This next question is for Jenny. If a person owes premiums from a previous year, can they switch to a different plan in order to stay covered without paying past due premiums?
Yes. The caveat being there has to be more than one issuer offering marketplace plans where the person lives. But as long as there is, the person can switch to another plan from another issuer and avoid that past due premium debt issue. Hopefully they can keep up with their premiums from the new issuer, because as we've said before, there is no look back to the past due premium policy now. So unless a state has a requirement or a limitation on that, then that ability for an issuer to require past due premiums as a condition of enrollment would sort of ride with the person for the long term. Remember that when a person is enrolling in a new plan that they weren't enrolled in the year before, they do have to make the first month's premium payment. This is sometimes called the quote binder payment, but they have to make that payment on time or they won't be enrolled and they can't enroll again until open enrollment or if they have an SEP triggering event. Yeah.
Thank you, Jenny. And I think we have time to squeeze in one more question. How does all of this intersect with Medicaid work requirements and more frequent redeterminations? What does it mean for people with volatile incomes that float above and below the federal poverty level?
Yeah, great question. Starting in 2027, states that have expanded Medicaid have to redetermine Medicaid expansion enrollees' eligibility every 6 months. Medicaid expansion enrollees also have to meet that work reporting requirement, as I mentioned before, unless the person qualifies for an exemption. And this is not a Medicaid policy webinar, but that's certainly things that we will elaborate on in our written materials. As Claire mentioned earlier, people who are not permitted to enroll in Medicaid or who lose Medicaid eligibility, or actually this is my section, sorry, it's not Claire's section, but if they lose Medicaid due to failure to comply with the work reporting requirement, then they won't be eligible for PTC for marketplace coverage. Now marketplaces, this is now where I'm going to start to speculate, but marketplaces could see more incoming applications as a result of higher churn in Medicaid, although not necessarily more people who are eligible. It's just a matter of there may be more applications churning in these systems across states. It's also worth noting that in non-expansion states, people with income between 100 and 138% of the poverty level who right now they qualify, they are eligible for premium tax credits, and they do not have to comply with any sort of work reporting requirement. So there's just some inherent inequity built into the way these new policies are being executed. Those individuals lived in a Medicaid expansion state, they would have to meet a work reporting requirement in order to enroll in and retain Medicaid coverage. So that's not a very hopeful note to end on, but Nicole, back to you.
Thank you, Jenny. So I just dropped some of the links to the slides and other ways to contact us. As a reminder, we will be distributing the materials from today's session via email, and we will post everything to the Beyond the Basics website at healthreformbeyondthebasics.org. Our annual fall webinar series will take place on Tuesdays at 2 p.m. Eastern starting September 9th. Subscribe to our email list to get the registration links, and the link to just subscribe is on the slide, and I just shared it in the chat, and we will share it after the webinar. As the series gets closer, you can register for upcoming webinars on the Webinars tab on the Beyond the Basics website. You can also find reference charts, guides, and other resources on the website. If you have questions or need assistance, I know we weren't able to get to everyone's questions today. Please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we will bring this webinar to a close. Thank you again for joining us today.